We're going to talk about what health questions are asked in the home study process. Hi, I'm Stephanie A. We haven't met. I've helped thousands of families form their families through adoption, and we have a very laid out step-by-step process that we take families through to help make the adoption process less overwhelming. So let's talk about the health questionnaire that you're going to have to do for the home study process. Now, this is going to look very, very different for each agency and what questions are asked on the form. So for example, at Adoption and Beyond, our health form is pretty basic. It's just an overview of your health. There's no blood work that needs to be done. Now, that is not going to be true for every child placing agency. Some agencies, you'll need to have blood work done. So this is just kind of a general overview of what you will see on pretty much every health form, no matter who you're working with in the adoption process. One thing I wanted to be sure that it was pointed out that everybody in the household will need to have a medical done. That's pretty typical across the board. So if you have other children living in your home, if you have your parents living in your home or grandparents or a roommate or somebody, whoever else is in the home is also going to need to have a health physical done as well. Overall, the health form is just looking to see that you have a normal life expectancy and that the doctor doesn't feel you have any medical condition that would prohibit you from being able to parent a child. That's pretty much the baseline of what you'll find and what they're looking for. And so sometimes we'll have questions. Will you be able to adopt if you have a chronic illness? Well, according to the CDC, 60% of Americans have some kind of chronic illness. So the answer to that is most chances are it will not stop you from being able to go through the home study process and ultimately the adoption process. So just be sure that if you have any concerns, just be sure you express those concerns at the very beginning, because it would be better to find out whether this is the right agency to do your home study from the beginning versus when you're partway through or at the very end where you're denied home study because of a chronic illness. So these are things that are important to ask, but overall, it's not going to prohibit you from being able to adopt. I had a family here recently who was in my office, and they were concerned about a chronic illness that the adopting mother has. And it's actually a pretty common illness that a lot of people have when experiencing infertility. And I explained simply, no, that will not stop them from being able to adopt as long as their doctor says they have a normal life expectancy and that their chronic illness would not be any reason for them to not be able to parent a child. Can I adopt if I have a mental illness? This is a common question that we get the majority of the time. No, it will not stop you, especially if you're under the care of a physician, you're taking medication for this disorder, and that you are stable on your medicine and that you have a historical ability to show that you have been stable on this medicine. So as long as you can get a physician who says that this will not prohibit you from being able to adopt a child, there's a lot of times when families who have a mental illness will be able to adopt a child just fine. And the last one is, can someone with a disability be able to adopt a child? And once again, far majority of the times, yes, they will be able to adopt a child, but it also just hinges on that physician that does your medical form. If for any reason they feel that it would limit your ability to be able to parent a child, then that is what we're going to go off of, because we're not an expert in that field. The physician is the expert, and we're going to rely on that expertise of the physician to let us know whether they feel that any condition that you have would prohibit you from being able to parent a child. And as long as they sign off and feel that it will not, it most likely, I would say most likely, will not stop you from being able to do the adoption process. And the reason why I kind of hesitate on that is because domestically, most of the time, you will not have any issues. If you're adopting internationally, that is where we can see mental health issues or chronic conditions or disabilities come in and make it more difficult for you to adopt, maybe from some countries, because some countries have a little stricter rules than what you'll find typically in the United States with a domestic adoption. So I want to thank you and to let you know, if you have any questions, please be sure you drop them in the comments below. I would love to see your questions, and also if there's any topics that you would like for me to discuss, because I do these videos for you, and so I want to produce videos that you want to watch. So I would love to have suggestions, because I've taken them and I have created videos. So be sure you let me know. I look forward to seeing you next time. Thanks so much. Bye.